Welcome to section 1, which is to define CCDF leadership and coordination with relevant systems for your fiscal year 2023-2025 Tribal CCDF Plan Preprint. We will begin as soon as we've allowed time for everyone to log in. So it's looking like we have a good number of people on the line. Just remember that we will be popping links into the chat periodically, so there might be some information for you to grab. I'm going to pass it off to Safi from our team, and she's going to give a quick demonstration on how you can access all of the resources for the Tribal CCDF Plan Preprint training on our website. So off to you, Safi.
Thank you, Shar. Hello, everyone. I just wanted to drop the link for the Tribal Child Care Capacity Building Center website, and I'll show it to you all right here. On this website, you will see plenty of resources that will help tribal lead agencies with their CCDF programs. And then the fourth link over here will also give you access to all of the slides and resources that we're going to be sharing throughout the virtual conference. And so this is organized by section. This was also shared during our previous session, and I'm going to drop this link in the chat as well. And this breaks everything down into section. We have it color coded. We're currently in section 1, but this is what you will have throughout the week for each section that we present. And when you click on each section, you will see that we have a copy of the PowerPoint and slides. Whenever we're highlighting any tips or considerations or other resources, they're also listed there as well. So this website is here for you for anything that you need an additional copy of. Pass it back to Shar.
Thanks, Safi. Hopefully this will be useful to you as you move through. There's also a resource directory in each section that has some additional resources maybe that we haven't highlighted during the presentation, but might be useful for you as you're making some decisions with your tribal lead agency. Thank you, Safi. So we're going to start out by just some quick introductions. My name is Shar Shank, and I'm the Deputy Project Director for the Tribal Child Care Capacity Building Center. I will be one of the presenters on this section of the plan, and I'm going to pass it off to Dolores.
Hi, everyone. My name is Dolores Rama. I am part of the Tribal Child Care Capacity Building Center as the subject matter expert on construction and major renovation. Welcome to our session. I'll now turn it over to Sarah.
Welcome, everyone. My name is Sarah English, and I serve as a Tribal TA Specialist for Regions 1 and 6. Welcome.
Thanks, Sarah. We also want to know who else is on the line with us today. So if you would like to pop your name into the chat box and which tribal lead agency you're representing today, we would love to know who's joining us. We're so happy that you were able to hop on this webinar. So then we're going to move on to some objectives for today's session. So in this session, we're going to provide an overview of how the CCDF program is administered, including the designated tribal lead agency and administrative structure of your organization. We're going to explore the option of administering the CCDF program through contracts and agreements, describe the importance of consultation and coordination in the development of your tribal CCDF plan, identify the different types of CCDF providers and their definitions, review the program integrity and accountability requirements, and examine the requirements of creating an emergency preparedness plan. We also want to point out that there's icons at the top right of the screen, the S in a green box, the M in a blue box, and the L in a purple box. This tells us that this section of the plan is for tribal lead agencies of all allocation sizes. You'll find these boxes throughout all of the sessions to assist you in identifying the sections of the plan that pertain to your allocation size. We also want to mention that we've color-coded each of the sections of the plan as Safi demonstrated on our website. And that way you will be able to quickly find the resources that are relevant to that particular section. So in section 1 of the plan, there are 10 subsections. 1.1, the tribal CCDF applicant. 1.2, the designated tribal lead agency. 1.3, administration through grants or agreements. 1.4, consultation of the development of the tribal CCDF plan. 1.5, Indian Child and Indian Reservation Earth Service Area. 1.6, child count. 1.7, which is a new section in section 1, the types of CCDF providers. 1.8, coordination of services. 1.9, program integrity and accountability. And 1.10, disaster preparedness and response plan. So you may have noticed this is also a new section in section 1. This used to be in section 2 of your previous plan. All right, just want to make a note that subsection 1.6 of the plan includes questions about the child count and definition of service area. This is unique to this CCDF plan because you would have submitted that information on or before July 1st of 2022. But the information you submitted in July is going to auto-populate into your plan in the Child Care Automated Reporting System, also known as CARS. Also, a quick reminder that this fiscal year 2023-2025 Tribal CCDF Plan Preprint is due by January 31st of 2023, and all of it will be submitted in CARS. So now I'm going to pass it off to Dee.
Great. Thank you, Shar. So starting with subsection of CCDF Leadership and Administration, we have 1.1, the Tribal CCDF Applicant, 1.2, Designated Tribal Lead Agency, and 1.3, which covers administration through contracts or agreements. These subsections are where you will provide information on how the CCDF program is administered, including the designated tribal lead agency and administrative structure. It also addresses who was consulted in the development of your tribal CCDF plan and how the lead agency plans to coordinate CCDF services with other entities. In questions 1.1, you will provide the tribal applicant information, which includes the name of the federally recognized tribe or official name of the tribal consortium, the leaders, tribal leadership's name, such as the president or the chair, or the leader of the consortium, and their official title, address, telephone number, and email address. So anytime this information does change during the plan cycle, so for example, a new tribal leader after an election or a new tribal CCDF administrator is hired, please reach out to your regional program specialist and provide the updated contact information or further instructions. So for questions 1.1.2, you will identify if you are a tribal consortium or not. If you are, you will continue to provide the additional information on the membership of the consortium, including the participating tribes or Alaska Native villages, the demonstration for each member, and a description of how the consortium coordinates services. So keep in mind that a tribal consortium refers to a partnership between two or more tribal governments authorized by the governing bodies of those tribes to allow that consortium to apply for and receiving funding on behalf of the member tribes. A demonstration from participating members could include a resolution, a letter signed by the tribal leader, an official document from the tribal government. The description should include how it coordinates childcare services that are provided in each tribe or village that is participating in the consortium. Summarize how the consortium is coordinating services, including direct services, on behalf of each participating member, and describe how childcare services are provided to each member of a tribe or village. Just want to make note, if there are changes in the consortium membership, the tribal lead agency must notify the Office of Child Care through an amendment to the plan. Tribes must designate a tribal lead agency to apply for funding and accountable for administering the CCDF program. Tribal lead agencies have considerable flexibility administering and implementing the child care program, determining the basic use of the funds, and identifying spending priorities based on the unique specific needs of the children and families in the tribal community. In 1.2.1, you will provide the name of the tribal lead agency and the website address if you have one. Tribes must also provide contact information of the tribal CCDF administrator who will be responsible for the day-to-day operation of the program and the primary contact. In this section, you will provide the CCDF administrator's name, title, mailing, and physical address, along with their phone number, cell phone number, and an email address. If the lead agency does have a co-administrator, you will add that same information for them in subsection 1.2.2. Again, just make note, amendment to the CCDF plan is required if an event of a change in the designated tribal lead agency's tribal CCDF administrator or co-administrator if it's applicable. Tribal lead agencies have broad authority to administer their CCDF programs through other agencies known as contractors. These include governmental and non-governmental agencies and other public and private local agencies. So for example, if a contractor is an agency, it could be owned by the tribe outside of the regular tribal government that has a memorandum of understanding or any type of agreement with the tribe to administer the CCDF program, or a portion of the program has its performance measured in relationship to the federal CCDF objectives. If the tribal lead agency chooses to use other agencies to implement the program, it still maintains overall responsibility for the program and serves as the single point of contact for CCDF administration issues. So when using subrecipients and contractors, the CCDF tribal lead agency is still responsible for deciding how CCDF funds will be used in determining priorities for the expenditure of their CCDF funds. So for example, if the tribal lead agency may have an agreement with a tribally owned nonprofit agency to administer the CCDF program, or the tribal lead agency contracts with a local tribal college to provide and track the required health and safety training for all staff. Another is if the tribal lead agency operates through grants or contracts, they must complete subsection 1.3. So again, just to note, this question does not apply to tribal consortia operations or the grants or contracts funding mechanism to providers. Let's move on to subsection 1.4, consultation and development of the tribal CCDF plan. As the tribal lead agency develops its tribal CCDF plan, they are required to consult with representatives of their local tribal government and community. For the purpose of developing of this plan, consultation involves meeting with or obtaining input from appropriate representatives. Here on this slide, this illustrates how consultation and representations fit into tribal CCDF plan development and implementation process. Here in the first box, we have consultation is a discussion between two or more partners to discuss the plan or decide something. In many cases, consultation implies meeting before a decision is made. So for example, during the development of your tribal CCDF plan, representation is ensuring the people you bring to the table accurately reflect your tribal community and speak to the childcare needs and services provided within the tribal community. So once the tribal CCDF plan has been drafted, the tribal lead agency is required to hold a public hearing and make the draft plan available for comment. The tribal lead agency must give at least 20 days notice of the public hearing and provide the date of the hearing in their tribal CCDF plan. Information gathered during the public hearing should be considered and, if appropriate, added to the tribal CCDF plan prior to the submission for tribal leadership's approval. Virtual public hearings can be provided with the understanding that meeting with information and providing context to the public should be clear and documented. A virtual facilitator should be available for an opportunity for the public to ask questions and offer comments So finally, once the plan is approved by the Office of Child Care, the tribal lead agency will coordinate the delivery of childcare services as outlined in your plan. We will cover coordination later in this presentation. Tribal lead agencies with medium and large allocation sizes must make their final tribal CCDF plan available to the public again and should post it and any plan amendments on the website to the extent practicable. Other options could include having a copy of your completed plan available in your CCDF or tribal government offices that is updated each time a plan amendment is submitted and approved. A public hearing is a scheduled meeting where the tribal community, which could include tribal leadership and the CCDF program, presents a review of their draft tribal CCDF plan. After the meeting, the tribal lead agency may allow for a period of time to collect public comment. Public comment refers to feedback on the draft of your tribal CCDF plan. The tribal lead agency can determine how comments are collected. So for example, they could be submitted online or through a tribal website, through an email, or even in writing, online or in print. Tribal lead agencies with small allocation sizes are not required to make the final tribal CCDF plan or any subsequent plan amendments available to the public, but have the flexibility to describe it if it's applicable. So for additional information on conducting a public hearing, please refer to this resource that we have, Public Hearing Requirements for the Tribal Child Care and Development Fund Plan. We will put the link in the chat box for you to access that. And it's called Public Hearing Requirements Frequently Asked Questions. All right, we will pause here and see if anyone has any questions or if there's questions in the chat box. Or if you're willing to take yourself off of mute and maybe even possibly, again, some of you might have already dropped in a question in the chat box. All right. Looks like my colleagues are helping me with the chat box. I appreciate that, Sarah and Char. And no further questions are being asked in the chat box. I'll go ahead and turn this part over to Sarah to continue our presentation.
Thank you, Dee. Next, we're going to move into subsections 1.5 and 1.6, Indian child definitions, service area definition, and child count provide important information to the Office of Child Care. Your definition of an Indian child and your description of your Indian reservation or service area will be used to determine eligibility for services throughout this plan cycle. Your child count will be used to determine your annual funding level for this plan cycle. For sections 1.5 and 1.6, you have already completed this information prior to July 1 of 2022. This information you entered will be auto-filled with your plan preprint in the CARS system. This includes section 1.5, the definition of an Indian child, 1.5.2, the definition of Indian reservation or service area, and finally, section 1.6, child count. Section 1.7, types of CCDF providers, is new to section 1. The goal of direct services in CCDF is to ensure that families have equal access to stable child care financial assistance through subsidy payments to provide eligible CCDF children with safe and healthy child care settings that support children's overall health and development. When considering direct services, you will need to decide who will provide these services to children. This is referred to as the types of providers. The final rule establishes 3 categories of care: center-based child care, a group care, is provided in a facility outside of the child's or provider's home. This type of provider includes tribally operated centers. The family child care provided in a private residence other than a child's residence. And the third, in-home child care provided in the child's home. Tribal lead agencies have flexibility in the types of child care providers they offer direct care to families and children. For example, a tribal lead agency may provide direct child care services through a tribally operated center, or a tribal lead agency with a small allocation size may not offer direct services at all. The types of providers you choose here will be reflected in Section 4 for tribal lead agencies with small allocations, and in Section 6 for tribal lead agencies with medium and large allocations. Subsection 1.7.1.1, providers offering direct services to families and children, is another new question in the Tribal CCDF plan. In this question, you will select the types of providers that offer services directly to families and children in your Tribal CCDF program by checking all the boxes that apply to your program. The following list includes tribally operated centers, tribally regulated, which would be approved or certified to provide child care services and monitored by your tribal lead agency, or licensed through a tribal licensing system, which is not required under regulation. Center-based providers, not operated by the tribal lead agency. This would include center-based providers who are approved or certified by the tribal lead agency or tribally licensed. Tribally regulated or licensed family child care providers. This would include family child care providers who are approved or certified by the Tribal CCDF program or tribally licensed. Again, not a requirement. State licensed center-based providers and state licensed family child care providers. The next slide provides additional options for you to choose from. Some states and tribes have a licensing system exempt certain types of providers from licensing. For example, school-age programs, summer programs, or family child care homes that provide care for only one child. If such providers serve children receiving CCDF subsidies, those providers must receive the required health and safety training and receive monitoring inspections under the law, even if they are exempt from state or tribal licensing. If you use those types of providers, you will check the next two boxes: license exempt center-based provider or license exempt family child care provider. Moving on to the next two options: relative care providers over age 18, in-home providers, care that happens in the home of the child. And then lastly, this tribal lead agency does not offer direct services to the families through the Tribal CCDF program. Remember, only tribal lead agencies with small allocations can opt not to offer direct services. So now we're going to pause for a moment and do a quick little group activity. As you reflect on all of the options that you have to check, which checkboxes would you check in question 1.7.1.1 if your program uses center-based care providers in the community who have been certified by your tribal lead agency? Feel free to come off mute and talk with us. Drop an answer in the chat. We're going to go through each one of these four options that you see on the slide. And then if there's any additional ones that you would like to share, we're happy to talk about those as well. So if your program uses center-based care providers in the community who have been certified by your tribal lead agency, you would select the tribally regulated or licensed center-based providers not operated by the tribal lead agency. If your program uses state licensed exempt families, friends, and neighbor care, you would look at selecting licensed exempt family child care providers. Your program uses relative providers over the age of 19. You would select the relative providers over age 18. And the last question on there, your program allows for in-home care on a case-by-case basis. In this option, you would select in-home providers, care in the child's home. Are there any other examples or questions that you would like to talk about for 1.7.1.1?
Sarah,
Yes.
Carolyn, I would like to talk about relative providers.
Okay.
So when you're saying in-home care, the relative providers, are they restricted to where the care happens? If it happens in the relative's home or in the child's home, is there a restriction on that? I don't remember.
So the restriction that you're going to look at here is going to be based on which of these categories you check. Okay. So if you're looking at relative care providers and you're wanting to ensure that the care can happen in the provider's home or in the child's home, you're just going to want to make sure that you have in-home providers selected also.
Yes, that's my question right there.
Yes.
So if we wanted them to have the option, whether it's going to be at grandma's house or at their own house, grandma comes over to their house, then we have to make sure we have both of those checked.
Yes.
Okay, because yes, if we don't have in-home, then the care needs to be happening in the relative's home.
Correct.
Okay.
Yes, if in-home provider is not selected, then all of the care provided through your program would need to happen outside of the child's home.
Okay, thank you. That clears it up for me.
Thank you. Okay. Any other questions? Are there household employer requirements when in-home care is allowed? So I'm not 100% what your question is. So if you're asking about the employer being like you employing your relative provider or the provider coming in, you still have to ensure that all federal labor laws are covered. And we talk about that a little bit in sections 4 and section 6. And then the other thing that I'm not sure, depending on what you're asking, is if you're talking about employment of the people who are in the household. And those items would also be discussed in 4 and 6 if you're talking about the eligibility requirements for your families. Feel free to come off mute and elaborate if you would like.
Sarah?
Yes.
Can you hear me? It's Luann.
Yes.
Your last bullet where it has your program allows for in-home care on a case-by-case basis. Would we check this if it was, say, part of our emergency preparedness plan and we had to shut down for COVID or no water in the community kinds of situations?
Most definitely.
Okay.
Yes,
Thank
that
you.
is a great example to bring up, Luann. Thank you. So when you're looking at these types of care, you may really reflect on what COVID has been like for your community and starting back up and what your EPDRR plan looks like. Because if there are on those case-by-case instances that you're going to kind of pivot and change the way you deliver services, in order for those to be allowable activities, they must be selected in your plan. So to keep you from needing an amendment, you will want to make sure you go through and select all of those that may apply in any of the situations that you see as laid out in your plan. So if your EPDRR plan has those instances where you might pivot and do things differently, just make sure all of those are accounted for in 1.7.1.1. And then through that, you'll start working on developing your policies and procedures through your EPDRR plan and the rest of your plan to ensure that you have everything in place to roll out those services. Okay.
I have a question, Sarah. Oriana here from Picky and Rancheria. I just have, do you have a resource or are there resources available for the labor laws to review for in-home care?
I believe we do have some links to link that to you, and they are mentioned in those other sections. And we can also make a note of that and make sure we have some of those resources pulled to share the links to the labor law requirements. Thank you for bringing that up.
That would be great. It's always been a question of mine and kind of like a gray area for our tribe as to what the responsibility is of the parents and the tribes with those labor laws for in-home care.
Yes, thank you. Okay. So yes, it looks like there's been several questions about the labor law requirements. And so as we continue to go through these sessions throughout this week, we will gather all of these questions from the chat and gather some resources to be able to share that information as well. Thank you. Okay, we're going to move on to our next slide, which is questions again. So any last lingering questions before we move on to section 1.8? Okay, so moving on to subsection 1.8, coordination of services. The plan states that the tribal lead agency is required to coordinate services with other tribal, federal, state, and/or local child care and early childhood development programs with agencies such as those responsible for public health, employment services or workforce development, public education, and the Temporary Assistance for Needy Families, TANF program. We will cover some of the ways tribal lead agencies can coordinate services in the next few slides. Tribal lead agencies must demonstrate in the plan how they encourage partnerships among tribal agencies, other public agencies, other tribes and tribal organizations, private entities, and community-based organizations to leverage existing service delivery systems and to increase the supply and quality of child care and development services. You will need to describe how the tribal lead agency coordinates the delivery of CCDF with the entities listed here, and then check and describe only those that imply. The list includes public health, employment services and workforce development, local schools and school districts, TANF, and this might be state TANF or tribal TANF programs, tribal or state child care licensing programs, Head Start and Early Head Start, child protective or welfare agencies, tribal early childhood or child care advisory committees, and entities that coordinate out of school care, which includes after school summer care programs such as Boys and Girls Clubs and other programs. Other examples of a description submitted by a tribal lead agency in the last plan cycle included: the CCDF director coordinates with the Public Law 102477 TANF program in our efforts to deliver services to their program clients. We set up program activities on a monthly calendar to involve them and inform them of childcare classes and first aid courses and encourage 477 TANF participants to apply for childcare assistance and or to become a childcare provider. Coordination with Head Start or Early Head Start might be beneficial to provide comprehensive childcare services to children who are eligible for both programs. I will read another description from a tribal lead agency. The CCDF program has a strong partnership with the Head Start and Early Head Start program. We communicate daily in our effort to provide a safe and stable environment for participating children. In this example, the CCDF manager meets with Head Start and Early Head Start Center daily to coordinate our efforts to deliver quality services to our children. The CCDF director works with the Early Head Start program in the development of an Early Head Start childcare partnership. In this partnership, the programs have a cost allocation plan and a memorandum of agreement between the programs. We will look at the remaining options on the next slide. Emergency Management and Response, Child and Adult Care Food Program, CACFP, Services for Children Experiencing Homelessness, Medicaid and the state's health insurance program, Mental Health Services, Child Care Resource and Referral Agencies, Child Care Consumer Education Organizations, and providers of early childhood education, training, and professional development, also called CCR&Rs. All tribal lead agencies are required to coordinate their CCDF services with other programs as listed in the plan. One example of a description of coordination provided by a tribal lead agency includes the Emergency Management Office includes the CCDF program in the Tribal Emergency Management Plan as a resource for the unification of families at the 5 learning centers located across the reservation. The CCDF program gives the Emergency Management Office a list of providers that may need rescue or resources in the event of a natural disaster. The tribe's Department of Public Safety calls each local tribally operated learning center when they are in an active threat in the area. Let's take another look at this slide we shared earlier. Once your tribal CCDF plan is approved and becomes effective, you will begin the coordination phase. Consultation may be something that occurs early in the process, whereas coordination may be an ongoing process that occurs throughout this plan cycle. Moving on to subsection 1.8.2, determining childcare needs for underserved populations. In determining the tribal community's childcare needs, tribal lead agencies must include underserved populations such as infants and toddlers, families experiencing homelessness, children with special needs, and children in need of non-traditional hours of care. In the plan preprint, you will check those that are included in determining the tribal community's childcare needs. This information could be gathered through your coordination efforts with the agencies we just discussed. In our next slide, we would like you to conduct an activity to strategize how this may look for your program. So now let's stop for a quick activity. We will randomly put you into small groups and move you to breakout rooms. While you are there, we'll take turns sharing which of the underserved populations you are planning on including in your plan and how you found information on their needs. If there is a need for more research to determine the underserved population in your community, some ideas that might help you get started. You will spend 5 minutes in the breakout rooms to discuss, and then you'll be automatically brought back to the main room at the end. When we regroup, we will give an overview of the conversations from each breakout room. Okay, so I think we are ready to go to our breakout rooms.
With that, everyone will be moving to breakout rooms for 5 minutes.
Okay, so as everyone's making their way back to the main room, we will just go through and give a brief overview of what was discussed. Would our TCBC partner from Breakout Room 1, like to share? I'm not sure
I
who went
believe
where, so.
I believe, I know, I just glanced at it. I believe we might have been group 1, but the question quickly was just how much of this information was going to stay in their plan. And a majority of them said all 4. And then just wanted to hear how this was determined. And some of them indicated that it had already been part of their plan for several years now. And it just seems like the more families that are wanting to receive childcare are basically, some of them are in these categories. So they do continue to see a trend that these particular items for the undeserved population will still remain the same, because this seems like the eligibility criteria still seems to be that the need is there. So I thought that was really good to hear.
Thank you, Dee. So I was in Breakout Room 2, and we talked about many of the same similar things, and that as a result of COVID, that infants and toddlers and school age slots had been kind of hard to come by, and that with the ratio requirements with some of the age groups and the short staff of the different centers and providers, that made it a challenge to be able to place some of our families into care. And some programs also shared that they used the other category on there and added additional underserved populations. And one specifically was looking at like kinship type care, children being raised by family members. And so one of the things that we talked about briefly was having those conversations with your regional program specialist as you go through the plan. And in this category specifically, thinking about where it might tie throughout the rest of your plan as well. So is this a portion where it might also fall into categories of protective services or those types of things, and making sure it's kind of consistent throughout your plan, and really having those conversations with your program specialist about what your goal is with each one of those, because they may have some ideas about where you can elaborate in different areas of the plan to help tie it all together and make it consistent throughout your plan. Breakout room 3.
So I was in breakout room 3, and we talked a little bit about infant toddler care. Seems to be one of the top priorities. In Oregon, throughout the state, it's pretty much deemed a childcare desert for infants and toddlers, as well as a program in Oklahoma that the need is there. And I'm sure it's, you know, infants and toddler ratios are so much lower that the cost of care is higher. Also focusing on children with special needs who may need, who possibly have some behavior issues, and it's hard to find childcare for those children. Also, there needs to be a little bit more research on the definition of homelessness and how that looks in their community. And then non-traditional hours, a lot of times relatives are taking those children overnight, but aren't necessarily enrolling in the CCDF program. And some of the strategies that they've used are to increase payment rates for infants and toddlers and children with special needs. And also possibly if you're not providing relative care at this point, you may consider that as a strategy for non-traditional hours and even only use relative care for that type of service. So that is what we talked about.
In room 4, our group shared out about serving underserved populations of children with special needs. One person shared out about how that experience can be so different depending on the child and the specific types of needs, and then how often child care centers do need particular training to meet the needs of children, and that those unique needs are so unique. Our group also shared out about how there was a difference in the different experiences that children have prior to entering provider care, you know, if they were in a preschool program beforehand or if they were not, and how that affected the way that they interacted within the provider care, and how that can also be an opportunity for growth when serving underserved populations. And then we also had some people share out about one way that they found information on needs would be a community assessment or a Head Start needs assessment. So that's what we talked about in room 4.
Thank you. Do we have a room 5? I don't remember how many breakout rooms we had.
We do have a room 5, Sarah. This is Teresa, and I think that it's very clear that there's an issue across the nation for infants and toddlers, having care for them. That was in the response from everyone that responded. Also, non-traditional hours of care and after school. One of our responses, they conducted a daycare feasibility study and they identified that it's infants and toddlers and after school hours that are suffering in their area. That was in Kansas. We had another response that identified also the families experiencing homelessness. And again, as mentioned earlier in the other groups, children with special needs. That grantee said that they collaborate with Head Start and Early Head Start to identify those 3 groups. So that's really nice to hear that collaboration for that grantee. And then another grantee, they are in the process of doing a survey, say they live in a rural area and before and after school and summer care is needed for school age, which is very, very typical of what the answers that we're getting on this activity. And then one of the responses, what their intent moving forward, what their plan is to help these underserved populations in their areas. I was really excited to hear that they're utilizing funds to build a child care that will focus on that group. So that was really nice to hear. And that is what we talked about in breakout room 5. Thank you, Sarah. Thank you, everybody that participated. That was a very nice activity.
Thank you all. Yes, it was wonderful information, and it seems like a lot of the same issues and concerns are happening across all of our tribal communities. So if you do have questions or concerns, feel free to reach out to your regional staff, to the peers that are on the call, and we can work together to find some solutions. Okay, so we're going to pause for all of the wonderful information that we have covered and see if you have any questions.
Sarah, this is Shar. I'm going to put into the chat. I found the link to the Federal Wages and the Fair Labor Standards Act that might be helpful for anyone who's looking at the fair labor laws for in-home care.
Yes, thank you, Shar. Okay. If you guys continue to have any questions, feel free to drop them in the chat and we will work on getting you answers. And I'm going to pass it off to Dee.
Thank you, Sarah. Thank you everyone again for participating in our activity. So now we'll move over to the next section in the plan, which is 1.9, program integrity and accountability. In this section, we'll discuss how you plan to identify and recover improper payments. Tribal Lead Agency, as a single point of contact for the administration of their Tribal CCDF program, is responsible for making sure that policies and procedures are in place to monitor programs and services and ensuring compliance with the rules of the program and providing oversight in the expenditures of all their funds, including identifying improper payments and undertaking fraud prevention and recovery efforts. In this section, you'll provide information on how you will identify and investigate fraud and recover improper payments based on your policies and procedures. Tribal lead agencies are required to describe effective internal controls to identify improper payments through program policies and fiscal procedures. The answers chosen within this section of the plan will be reflective of your current policies and procedures. Improper payments could include any CCDF payment that should not have been made or was made on an incorrect amount based on statute or policy, including overpayments and underpayments. Another is payments made to an eligible recipient, payments made for an ineligible good or service, payments for goods or services not received, except for such payments authorized by law. In this section of the plan, you will select all the strategies your tribal lead agencies will use to prevent fraud. To assist you in completing this section, you may want to consult with your finance department or review your current fiscal or program policies and procedures. The tribal lead agency is required to investigate and recover improper payments that are in the results of fraud. So here in question 1.9.1.2 asks, how does the tribal lead agency investigate and collect improper payments resulting from fraud? You will check only those that apply. So as suggested before, consult your finance department or even your tribe's legal department for the current policies and procedures prior to completing this section of the plan. Some lead agencies add a dollar amount in the second checkbox as they have considered the cost of recovering fraudulent payments and ensuring the cost of recovery doesn't exceed the amount they would recover. The lead agency has the flexibility to recover improper payments that are results of unintentional errors or program violations. So in this question, you'll share if the tribal lead agency chooses to investigate and collect improper payments resulting from unintentional errors or program violations. Tribal lead agencies do have the flexibility to choose not to recover payment in these circumstances. Some examples of unintentional errors include the CCDF intake worker is new to their position and miscalculates the family income. The family has over 85% of the state median threshold, and the provider had already received payment for their services for the last 3 months. Another is a provider submitted an invoice with an error in the calculation of hours and had received payment prior to the mistake being discovered. In addition, another example is a child aged out of the infant room and moved to the toddler room that is paid at a lower payment rate. The CCDF worker forgot to update the paperwork to alert the finance department to adjust the payment. So here again, we'll just pause a little bit and see if anybody has any questions around 1.9. And you're more than welcome to continue to add your comments or questions in the chat box.
So Dee, we have a question in the chat box of how does the Department of Labor apply to non-licensed relative home caregivers who are identified as independent contractors in order to receive CCDF subsidies on behalf of eligible families? The DOL seems to impact those that are identified as employees. That was a long question.
So I do know on the Fair Labor website that I posted, there is a frequently asked questions on domestic workers. You might want to start there. I don't think we know the answer to that off the top of our head, but that might be a good place to start that research, is under the domestic workers section.
Thank you, Shar. Well, that concludes my part of the presentation, and now I'll turn it over to Shar to take us to our next 1.10.
Thanks, Dee. So moving on to this new section in section 1, emergency preparedness, disaster response and recovery, also known as EPDRR. In past disasters and in response to the coronavirus disease of 2019, also known as COVID-19, the provision of childcare services and the process of rebuilding and restoring the childcare infrastructure has emerged as an essential service. Let's see. Tribal lead agencies are required to establish a childcare disaster plan for their tribal service area. And we understand there may be a few tribal lead agencies that do not currently have fully implemented EPDRR plans. And this is a great opportunity to learn what information is needed in each section of your plan, as well as to connect with peers that might be able to assist you in the development of your EPDRR for your tribal service area. Tribal lead agencies must describe how they will address the needs of children, including the needs for safe childcare before, during, and after a state of emergency is declared by the governor or tribal chief executive, or a major disaster or emergency as defined by Section 102 of the Robert T. Stafford Disaster Relief and Emergency Assistance Act. Right, so coordinating and collaborating with your key partners goes hand in hand with the development of a community-wide disaster plan. You must join all your efforts to create an effective disaster plan for your tribe's service area by establishing an effective disaster plan through coordinating and collaborating with the appropriate partners and coordination with other tribal programs. In question 1.10.1.1, you will describe how the child care disaster plan was developed in collaboration with the appropriate partners, which may also include other programs within your tribal lead agency's governance structure or other partners identified by the tribal lead agency. Tribal lead agencies should consult with agencies and partners that are relevant to their service area. So here are some considerations for key partners you could collaborate with. Tribal or state human services agencies, if different from the lead agency. Tribal or state emergency management agency, your local police and or fire department. Tribal or state child care licensing agency, tribal or state health department or public health department, tribal or state and local resource and referral agencies, and state advisory councils on early childhood education and care. We know that each tribal community looks differently, and that each of these agencies will really depend on what type of emergency services is available. The one tribal lead agency provided the following description in their last plan. Just as an example, the child care director is a member of the tribe's disaster response team. The director is responsible for planning and implementing the child care disaster response plan. The director met with program directors from other agencies, including the transportation program, the emergency management office, and the tribe's law and order committee, the tribe's executive director, and the child care department supervisors to develop the tribe's disaster plan. So if you look at these slides on our website, it will have all of the talking points. So if you want to hear or see that example again, you can just download the slides and you'll be able to see what someone else has written in that particular question. Moving on to question 1.10.2.1, you're asked to describe how the child care disaster plan includes the tribal lead agency's guidelines for the continuation of child care subsidies and child care services, which may include the provision of emergency and temporary child care services during a disaster and temporary operating standards for childcare after a disaster. Overall, your childcare disaster plan should include specific information on how you will minimize the disruption of childcare services for families and children during and after a disaster. What does your current childcare disaster plan say? Does your current disaster plan need to be revised? You may want to reflect on your program's experiences during COVID-19 to assist you in developing or revising your plan. Many tribal lead agencies were able to develop ways to continue accepting applications, providing payments to providers, allowing for relative care once the tribally operated center closed, and develop temporary operating standards to ensure that families and providers were able to maintain childcare services. It's important that lead agencies have a plan in place to perform essential functions and achieve programmatic continuity during and after an emergency or disaster for families receiving CCDF benefits. These essential functions could include continuing payments to childcare providers serving children and receiving subsidies, provisions for extending eligibility or redetermination timelines for families, communication with the licensing agency to ensure that licensed programs receive CCDF funds that are safe and operational. And just remember, you're not required to have a licensing agency, but if you do, keeping in contact with them is important. Assist new enrollees or prepare for a sudden influx of families who may need assistance. Implementing a waiting list if the tribal lead agency does not have one or as appropriate, and tracking families receiving subsidies impacted by the disaster. So think about your current disaster plan and consider the essential functions listed on the screen. Use your disaster plan to complete this section of your CCDF plan, and be sure to include these essential functions in your plan development. Childcare services must be restored as quickly as possible following a disaster to provide children with a safe environment and sense of routine while parents make efforts to rebuild their lives. In question 1.10.3.1, you'll describe the procedures for continuation of post-disaster recovery of childcare services. This recovery could include how you communicate and coordinate with providers on their childcare needs. These needs could be supported with quality grants for minor renovations, mental health supports, or even additional training for caregivers, teachers, and directors. These strategies could be included within the larger community plan that includes plans for restoring and rebuilding childcare facilities and infrastructure, including working with emergency management officials, licensing agencies, and public health officials to conduct timely assessments of the damage and the status of the child care providers within the impacted area. Engagement and training of child care providers to ensure business continuity should a disaster occur, including adequate insurance coverage and protection of records and assets. Provide information and resources to childcare providers about financial assistance that is available for the rebuilding process if they need to rebuild. Engaging business associations, community development, financial institutions, and other organizations that can potentially provide financial assistance or microloans to help childcare providers reestablish services. Preparedness planning with Federal Emergency Management Agency, or FEMA, regional officials to clarify childcare services that are eligible for reimbursement under the Public Assistance Grant Program. So what does your current childcare disaster plan say about post-disaster recovery? Are there any revisions needed? You will describe what you plan to implement based on your childcare disaster plan in this section. Question 1.10.4, the tribal lead agency is asked to provide a description on how you will ensure that providers who receive CCDF funds, including the tribally operated centers, have the following procedures in place: evacuation, relocation, shelter in place, lockdown, communication with and reunification with families, continuity of operations, and accommodations for infants and toddlers, children with disabilities, and children with chronic medical conditions. As a side note, the tribal lead agency should also describe these requirements for CCDF providers in section 2.2.1.7, standards and training requirements for emergency preparedness and response planning. It's important to maintain this information for all providers, including tribally operated centers. Maintaining adequate records ensures that tribal lead agencies have the information they need to communicate, locate, and support providers during and after a disaster. We wanted to share a couple of new resources that might help you develop your plans. The first is how to develop an emergency preparedness, disaster response and recovery plan, tips and considerations for tribal lead agencies with a tribally operated center only. We are going to put the link into the chat box, but if you look on the screen, there is an arrow with like a tablet. Basically, this information on this first page can help you answer question 1.10.1, where you're going to describe how the child care disaster plan was developed in collaboration. So there's actually some considerations and tips that you could look at as you work through your planning process. And I see that, Safi, you've switched the screen up. So we'll scroll a little bit through this resource, or you just zoomed in. All right. If we have some time here, we have about 15 more minutes. I'll actually open one of these documents and give you a little bit more of a highlight of it as we go through. All right, so we'll go to the next slide. And the second resource, as you can see, looks very similar to the first. It is a tips and considerations document on how to develop emergency preparedness and response plans if you operate a certificate or grant or contract funded program. So you don't have a tribally operated center, you're totally working with different providers in your community. And we're going to add that link into the chat box as well. And so throughout the document, it looks at each particular question in your plan and gives you some tips and considerations on how to develop that portion of your emergency preparedness and response plan. Okay, so emergency preparedness training is also an essential piece of your emergency preparedness and response plans. In question 1.10.5, you'll describe the tribal lead agency's training requirements for staff and volunteers and how they ensure training is completed. The training must include practice drills. Your description should include an overview of the policies and procedures you have in place as listed in your current child care disaster plan. So before we move into the activity, we have a question. Are we able to download the PowerPoint slides that are being presented? Yes, we'll put the link into the chat box again. All the PowerPoint slides with talking points for each of the sessions are available for you to download, as well as those resources that we just talked about at the same link. Thanks, Safi. Okay, so for this activity, we're going to provide an opportunity to participate in an activity. And we're going to switch our screens to an idea boards, and we're going to put the link into the chat. So all you have to do is go to the chat and click the link, and it's going to take you to this idea boards that Safi is sharing on her screen. And so for this activity, you will put your responses in by clicking the green X. So you actually have to go in your browser and add some information. So we would like to know for each section of your plan. Which stage are you in at the stage of implementation? So are you just exploring? You're just getting started? Are you developing? You're drafting some plans and attending some meetings, or are you implementing that you have a plan in place? So we're going to let you get started. So your choices are exploring, developing, or implementing. So go ahead and click on the link and start putting your responses into the chat box or into the idea boards.
Shar, this is Dee. I think one question that came up when we were in person is, do we put our tribe's name? And you could put your tribe's name if you'd like, or again, if you want to keep it anonymous, then do so in that way. But again, this is just a great opportunity for you all to connect with each other. Just like this previous question in the chat box from Melanie. She's asking those of us here participating in session 1, if anyone has encountered a scenario in which tribe does have a center, families use their state licensed center home-based or home-based care, and during the emergency child care centers, when they're closed, how have some tribal lead agencies written in their plans that they have ensured care continues? I think she's asking all of us as participants, as lead agencies, for any feedback on what everybody else is doing. If you're willing to share this response to Melanie, please enter in an email address or connect with Melanie in a way where you could help her in regards to this particular ask.
Thanks, Dee, for calling that question to our attention. I also want to point Melanie back to the resource, the tips and considerations for developing your emergency preparedness plan for if you're using certificates, grants, or contracts. It really does talk a little bit about, because it definitely looks different if you're not operating a tribally operated center. So there might be some examples in there that would be helpful for you as well. No worries. Sometimes it's hard to type everything into the chat box that you want to say. But if another grantee on the line has some tips for Melanie, who do offer, who have developed a emergency preparedness plan, or, are working on it, things that they'd like to share, go ahead and pop it in the chat or take yourself off of mute and share with Melanie.
Hi, this is Deanne, and I'm working on my emergency preparedness plan. And I'm sorry, I stepped away for a minute and just kind of walked back in, so I'm not exactly sure if there was a specific question. But as I develop my plan, I always send it into my program specialist at the regional office, who then reaches out to TNTA and they review it, and then they send it back to me with specific guidance on which sections they think that I need to maybe take another look at, and also, and they've given me a lot of support and a lot of good ideas about things that I might want to include in the plan, or places that I might want to go back to within my tribe to get more information, so that my plan is more, will meet the requirements. And I do have to say it's taken several revisions, but I'm really close to getting it approved. So I would just encourage everyone to reach out to your program specialist, and they'll hook you up with the TA specialist that works on these plans. And I just have found their support and assistance so valuable for helping me to get this done, because it was something that I've never really done before, and it was a process that I was kind of overwhelmed with and not really sure how to go about it. But reach out to them. They have lots of good examples, and they'll give you all the support you need to get it done.
Thank you for sharing that, Deanne. That's great advice. And then I've noticed somebody put in that they have implementing but needs to be updated. So I was a past CCDF administrator, and I thought I had a pretty decent emergency preparedness plan in place. And then we had an emergency, and really best practice is to reevaluate your plan after you've gone through an emergency, just to see if it worked well or if maybe you needed to change something. So it's kind of like a living document, like your policies and procedures. I don't know if it'll ever be done completely finished, but once you get something developed, get it approved as quickly as you can, because you can always go back and update and change it if you find things aren't quite working the way you thought they would. And then Matthew says, I currently work at the NPAI-HB as an institutional environmental health manager and served as the public health emergency manager for IHS Portland region, and worked with several tribal healthcare, childcare in the region to include real responses. If assistance is needed in plans, drills, training, please feel free to reach out. Matthew Ellis, and he put his email in the chat as well. So that is another good resource. If you want to talk more with Matthew, you can reach out. Some of the other people who are in the implementation stage, or if you feel like you have a pretty good disaster plan in place and are willing to have conversations with others, if you want to put your email address into the chat, I'm sure many people would appreciate that as well. So we're going to close out this activity. I see a lot of people are exploring and developing. Probably most of the people are in development, and a few people in implementation. So we appreciate you sharing. So to get back to the Zoom room, just look at the icons on the bottom of your screen and click the Zoom link, and that should take you right back into the Zoom. If you have any problems getting back in, just let us know. Oh, thank you for putting the full name into the chat box. All right, so we're going to go to the next slide just to quickly debrief. And like we said, there are several of you on the line that are still exploring. Most of you are developing, and some are in implementation. And sometimes, the same person could be in implementation in one of the areas, but still developing some of the others. And we want to just let you know that's okay. As Deanne mentioned, reach out to your regional office if you want some additional assistance. They can hook you up with the TCBCTA team and help you finish up your disaster preparedness plans. Also, remember, you can always come to the Writing Cafe on Friday and get some additional help or conversations around disaster preparedness. So we're going to go to the next slide. And again, if you want to connect with someone on the line, or you're willing to have conversations with others, you can put your name in the chat box with your email address. Maybe if you're looking for something specific, you could put that there. Or if you feel like one section of your plan is really strong and you'd like to share with others, you could connect that way as well. Okay, we're going to go to the next slide. And if you still need some more resources on developing a disaster plan, we do have the information memorandum on developing an emergency preparedness response and recovery plan. We'll put the link into the chat box if you're interested in that. There is some good information there that might help you. And then on the next slide, you'll see there's an appendix A, which is a checklist that is a part of the information memorandum. We'll put the link in the chat box again. And this is a checklist for developing your plan. And then appendix B is an emergency preparedness and response resources. So any additional resources that are out there, those are in appendix B for you to look at. So we're going to stop just real quick to see if anyone has any more questions as we kind of round down this presentation. All right. So on the next slide, we have prepared a resource directory specifically for section 1 of the plan. It has each of the subsections and the relevant resources based on each section that might be useful to you as well. Again, excuse me.
Oh, I'm sorry to interrupt. I was on mute and I was talking. I didn't realize. I do have a question in regards to, hi, my name is Alexa Sierra. I'm from the Kickapoo Tribe of Texas.
Hello.
Hi. I do have a question in regards to the emergency plan. Is there like a certain format that we have to follow? It's basically up to the tribe, just as long as we cover those areas.
Right. It's basically up to you. I know sometimes I get hung up on formatting, so sometimes it's nice to look at somebody else's plan, but there's no requirements as far as formatting as long as all of the pieces are there.
Okay.
And you can reach out to your regional office. They may have another grantee's emergency preparedness plan that you could look at for formatting.
Yeah.
So sometimes that helps me anyway.
Yeah. I'll reach out to Ms. Deborah Daniels. Okay.
Okay.
Thank you so much.
All right. So again, this resource directory is on the website. You're going to click on section 1, the red colored icon, and all of the information that we talked about today, the slides, the resource directory, and the tips and considerations documents are all there for you. I highly recommend that you download the tips and considerations document for emergency preparedness planning. So before we end, we would just like to provide you with some questions you can ask yourself as you reflect on this session today. So you might want to wonder, what questions do you have for your tribal leadership or your planning team? So maybe there's some things that you heard that you may want to implement in your program, but you need to talk to somebody at the tribal leadership level. What questions do you still have regarding this CCDF plan section? What strategies would you like to apply in your CCDF program? What are your next steps for completing this CCDF plan section? And what technical assistance might you need to support your next steps? So as you kind of think through those, you can kind of prepare for the Writing Cafe on Friday. We are also having office hours for each of, after all of the preprint training is finished up. They will be starting on Tuesday afternoons from 3 to 4 every Tuesday until the plan is due. We can pop that registration link here before we end as well. Let's see. Okay. So moving on, we are going to pop in the chat box a feedback survey. We would love to hear how this information was useful for you today. This survey will basically be for all sections of the plan this week. So if you want, you could wait until after the last plan section for your allocation size and complete the survey once. It's entirely up to you. Also, we're going to pop in the registration link for the Friday meet and greet and Writing Cafe in the chat. And I'm not sure if our team can quickly grab the registration link for the tribal office hours. There will be one link and you can join whichever of the Tuesday office hours that best fits your needs. There's no responsibility to attend all of them. We will be providing a little bit more information about different plan sections and also some breakout sessions for you to talk with your regional office as well. So with that, we want to thank you for your time. We really appreciate you. We appreciate those of you who have participated in the conversation and are providing support to others. And we look forward to our next session here after our half-an-hour break, and it will be on quality improvement. So thank you all for joining us. Have a quick break and we'll see you here shortly.